Hello, welcome all. And here is Dr. Ami Dakshini, dermatologist and a very passionate aesthetic dermatologist, talking to you today about something very special in anti-aging. Special for me, and I think also special and very convenient for you. And which is why today I'm here to demystify the dermal filler. Now, what is this and what is filler? I'm going to talk to you about it today in details. Also, what are the indications? Why should we use the filler? Is it safe to use a filler? Does everybody need it? Which age? And what are the indications? So let's demystify the dermal filler and let's talk about it in details. That'll help you as well as me to make you aware about all that is available to all of us. Technology and science is growing so fast, as I said even earlier, that everything that we wish for is right there in front of us. We want to look, and here it is, we want to look, the face needs to look a little oval with high cheekbones. Here it is. We want to get rid of the lines and wrinkles. Here it is. You name it and you get it. And that's the wonder of dermal filler. Now, what is it? Let's take it one by one, right? So dermal, what is dermal or dermis? I'm sure you all know about the layers of the skin. And if you see, the superficial layer is the epidermis. The second layer is the dermis. Now, this is a very important layer because this is where all the anti-aging mechanisms start and end. Now, dermis, it contains three very essential parts. One of it is called the collagen. The second is elastin. And the third, which holds, it's a gel that holds everything together, is called the hyaluronic acid. Now, you know what is the use of collagen? Collagen gives us the strength, the skin, the strength to hold, right? Elastin gives us elasticity. And hyaluronic acid gives us the soft, supple look, a filled look. With aging, which is both extrinsic as well as intrinsic, what happens is just with collagen and elastin degradation, hyaluronic acid also starts reducing. So the content of it reduces. And what we notice is that the volume reduces. And that is why you see hollowing of the cheeks. You notice grooves called the laugh lines. You have the marionette lines. You have the jowls which are visible because of sagging. So all this together gives us an aged look. What do dermal fillers do and how do they come into the picture? Now, as we are talking about anti-aging, the last session, if you would have attended or seen later, I had spoken about the botulinum toxin, which works on the muscles. Those are the lines of expression. Dermal fillers work basically on lines and grooves. They help lift the skin. They help you give volume. They smoothen out the lines and wrinkles. So then where do we inject them? We inject them in all areas of the face and neck wherever required. So if you see depression on the forehead, if you notice your temples going in, if you notice under eye that has got a little depressed, we call it the tear trough. The smile lines or the laugh lines, which are due to the nasolabial folds. The cheek, which is sagging. The nose that has got a little expanded. The lips that are flattened, there are vertical lines on the lips, jowl lines, chin, or the jawline which is not well defined. All these areas can be filled using hyaluronic acid or dermal fillers. Today I'm restricting to the dermal fillers containing hyaluronic acid. There are many other things available in the market, but today we will restrict to hyaluronic. And why do I say that? It has two benefits. One, hyaluronic acid is naturally present in our skin. So it's easier to inject something that is already there. It's accepted much better. The second function about hyaluronic acid is that it has a great capacity to imbibe or absorb water. And when it absorbs water, you notice that the filler actually grows in size gels with the surrounding skin and does not look abnormal. And the great part about it is it's temporary. It lasts for about 9 to 12 months, sometimes 18 months. So if you want a little change, or if you want to, do it a little differently, it works beautifully. Now, how does this hyaluronic acid come and what does happen? Today I've gotten, not that this is the best brand, I have this in my clinic, so I'm showing it to you. This is how they are packed. And in the box comes a syringe with a needle, with 2 needles. So this is how you see hyaluronic acid. If you see, there is a gel inside. I will show you how exactly it looks. If you see here, it's just like a transparent gel which just completely gets absorbed into the skin when you inject it. The needles are also very, very thin, and all these gels are supplied inside along with the hyaluronic acid with a anesthetic agent like lidocaine. So generally it's a painless procedure. Now these hyaluronic acids are differentiated by its molecular weight and its cross-linking. How are the bonds linked? If you want to fill deeper lines like the nasolabial, or if you want to lift your cheeks or the mid-face, that's when you need really thick or deep fillers. So you have deeper molecular weight hyaluronic acid which is put in deep right up on the bone. It works as an implant. If you're looking for superficial lines like the under eye or the lip lines, there's a little more superficial filler which is not as thick and not high in molecular weight. And the least is for the super thin liquid hyaluronic acid which can be injected. All these injections are extremely safe. Just remember, done in the hands of the right doctor who has the aesthetic sense, who understands facial anatomy, and who can help you understand your own face and decide what's best for you is really going to help. Hyaluronic acid, as I said, is absolutely inert. So it does not cause any allergic reactions. Neither does it cause any side effects. The simple side effects that you notice is just a little bit of redness or bruising post the injection. Very rare complications could be if injected into the blood. So otherwise, it's an absolutely safe procedure done in the hands of the right doctor. Multiple questions again come is that, doctor, what age should we start this from? So age, if you see, is according to your skin age. So at 20, you might have a deep laugh line. Or at 50, you might just not have anything much. So the age is more specific to your skin age and not your biologic age. Need to assess and figure out where you need a little more filling, and that's when you should go ahead and do it. Indications, as I elaborated, but now I'll tell you in detail, is that if you see very simple indications, if you look at my face, if you see the nose, if I just give a little bit of lift to the nose here, there is a better profile that is visible. If I just augment a little bit of my cheeks here, I get a lift. If I augment my eyebrows a little, just the under eye, I get a beautiful arching of the brow. So these simple indications work very well with dermal fillers. Remember, it's not the amount as much that is important. What is important is the right product. In India, hyaluronic acid is available in multiple brands. I will just name a few. Allergan has a beautiful brand called Juvederm. Again, it has all the layers, so you can, and your doctor can decide and choose the right one for you. You also have Restylane, which also works beautifully on your face. You have the deeper one, the superficial, and the mid-level one. You also have Bellotero. That's also a beautiful hyaluronic acid which you can use on your face depending on what your doctor discusses with you. Multiple fillers available. There is a Perfecta from France which also works beautifully. It is a deeper filler, thicker filler, which gives you good implant effect. Dermal fillers in combination with botulinum toxin works very well because it gives a complete look on your face. It reduces the lines and wrinkles which are caused by facial expressions. It also reduces the sagging and the deep grooves that you see in the lower face. Combination works very well. It also saves a lot of time and effort and money when you actually have to go down and do surgery, which has more downtime, and of course it's more expensive. The pro of course here is that it's an office procedure done in about an hour and you're out. It lasts for about 9 to 12 months. Hyaluronic acid topically applied also really helps. You can apply after the procedure a hyaluronic acid based cream with retinol throughout the year, and I have seen personally that the filler effect is much more. Try using other non-surgical procedures like radiofrequency, like thermage, to stimulate collagen so that the effect of the filler as well as the botulinum toxin lasts longer. You at least all the misinformation about dermal fillers has reduced. It's an absolute painless procedure done with anesthesia, which is present in the syringe. Also, it can be done along with icing, so you numb the area. If I just show you how exactly the dermal filler works, I've just injected it into my left, and if you see my right, it is not injected. You can see the difference just in this of how it fills and how naturally it fills. So you can see exactly the flattening of the lines, the change in the texture as compared to my right side. Yeah, so this is how beautifully it works. Very simple, extremely elegant, and gives you a natural look without any side effects. I hope you try it, and I hope if you have any questions, just please feel free to ask me. I will also try and do a video where I'm actually injecting it on a patient. That will also help you understand. And this actually brings kind of an end to anti-aging. Next time, I want to talk about skin health. In this pandemic era, we're all facing with immunities crisis. We're all wondering about how we should improve our health. And skin health also is a part of our body health. Skin is the largest organ of our body, and we need to take care of it as we do and think about other organs. I'm going to start a series from next Wednesday where I talk about skin health. And my first is going to be on probiotics and how it affects our skin, our gut, as well as our neural axis, our brain. I hope you join me next week when I talk to you about probiotics and the wonder of this drug. This is called a secret life that lives on our skin. Let's discuss about it more and let's understand its uses and benefits. I hope this anti-aging series has helped you, and I wish that you read more about it. And if there are any questions, as I said earlier, please do ask me. Remember, beauty is in the eyes of the beholder, but beauty is also mathematics. So if you understand what's best for your face and what's beauty, you can actually change it now with science, technology, and medicine, and of course with the right doctor. So I hope to see you again next Wednesday with all your questions answered this week, and with another video hopefully on dermal fillers. Thank you so much for a patient hearing. Stay safe and see you soon. Bye.